Educational video for falls prevention in the community. Meet Ms. K. She is an 86-year-old widow living independently in a building designated as supportive housing for older adults in her community. She has a number of family caregivers living nearby to help her with various daily tasks. Overall, her physical and mental health is good. However, she uses a walker because of the decreased strength, poor balance, and tendency of her right knee to give out. In the last week, Ms. K had experienced 2 falls, which heightened her fear of falling. Today, Ms. K was tired and decided to go to sleep early. In the middle of the night, she awoke feeling hot and walked to her bedroom window to open it. While attempting this, she lost balance, fell sideways, and landed on the floor. She used her lifeline button, and her daughter and son-in-law came over to assist her. While her family was trying to help her stand up, her right leg kept buckling. She was taken to the ER by ambulance and was admitted to the hospital for rehabilitation and medical investigation. Let's rewind and figure out why this happened. To investigate this fall, we will use the Systemic Falls Investigative Method. This is a systems approach that looks beyond the immediate causes of the fall to reveal other hidden influencing factors. This method shifts the focus from the faller to the system and removes the blame. To show this, we will use the Swiss cheese model of accident causation. This model includes unsafe acts, preconditions, supervision, and organizational factors. Essentially, the holes in the Swiss cheese represent the flaws in the system. By the way, did you know that airplane crashes are investigated using a similar model? Anyways, let's take a closer look at Ms. K and the factors that influenced her fall. Ms. K had a heart condition, so she takes blood pressure medication Avapro to keep this problem under control. However, for the past 6 days, Ms. K has been taking a double dose of this medication, which compromised her overall functioning. Why was she over-medicating? Both the pharmacist and doctor believed that they gave Ms. K and her daughter the correct information to stop her previous dose of medication and start her new dose. But this was not the case. Clearly, there was a lack of communication between professionals, which affected communication between the professionals and the patient and her caregiver. Why was there a lack of communication? Because there is no shared electronic system in place for medical professionals to use. In addition, physicians do not have instant access to current drug lists and rely on their patients to provide this information. The medication dosage mix-up was not the only factor that played a key role in Ms. K's fall that night. Lack of communication seems to be a common factor in Ms. K's case. Months prior to this fall, when she was discharged from a hospital stay, she was offered in-home support by the Community Care Access Center, or CCAC. Ms. K declined these services as she decided to stay with her daughter. A month later, she moved back into her home apartment, where her supervision by informal caregivers was limited and less frequent. Her daughter was busy taking care of her own husband and children, and other family members lived out of town. When the CCAC service was denied, no short-term service plan was put in place to ensure her needs were met. There was no file opened and no telephone follow-up was made by the CCAC. Why? Because Community Care Access Center case managers feel they are too busy managing active cases to follow up with those who denied services, like Ms. K. Her and her daughter attempted to get help from the CCAC after Ms. K had 2 falls earlier that week, with little success. Why? Because there is a delay of service implementation by the CCAC. Now, let's go back to the scene of the fall. That night, Ms. K was hot and tried to open the window. Because the window was above shoulder height and has a latch, she had to use both hands to pull it to the side. Why did she need to open the window? Because there is no thermostat in her room to control the heat. The high window and no thermostat in the room are just 2 examples among many others to show how this building is inadequate for seniors with health problems. Yet this building has been designated as supportive housing by the local health integration network. Why was this considered supportive housing despite features that are not age-friendly? This distinction was given to this building because of the number of seniors living in it and the proximity to places like shopping malls and grocery stores, not because of its appropriate physical design. Why? Because there are no minimum standards or policies to guide the local health integration network to this distinction. So there you have it, the case of Ms. K. What do you think were the major contributors to Ms. K's fall? Ms. K's case is just an example. Factors such as comorbidities, environmental factors, miscommunication, lack of supervision, and lack of appropriate standards or policies are common contributors to falls of older adults living independently. Let's move to solutions. This is where your expertise is needed. What do you think are solutions to improve the safety of Ms. K and others like her? And what can you do within your organization to prevent these falls from happening again? Thank you.